The threat posed by the Zika virus. We're now hearing it could be classed as a global health emergency, according to the World Health Organization. Officials have warned that the virus is spreading at explosive speed. Later, we're expecting the International Olympic Committee to issue advice on the virus ahead of the Rio Games this summer. Scientists say a vaccine for the virus, which is thought to cause severe birth defects in babies, could be ready within a year, which is far earlier than previous estimates. The virus has now spread to 23 countries in the Americas after the first case was recorded in Brazil, where there are now thought to be around 1.5 million people affected. The World Health Organization has set up a Zika virus emergency team, and it's warning the threat of the virus has reached alarming proportions. Well, the last time an international emergency was declared was for the Ebola outbreak in West Africa, which has killed more than 11,000 people. So what is known about the Zika virus? Well, it is transmitted by mosquitoes. The illness is usually mild, with the most common symptoms being fever, rash, conjunctivitis and joint pain. But the biggest concern is the impact it could have on babies in the womb. It is thought to cause babies to be born with small brains, a condition called microcephaly. So far, there is no known cure. The slums of Brazil have become the front line in the fight against the Zika virus, as our correspondent David Shookman explains.
The challenge is that everywhere you look there are little pools of water, and because in a favela like this the supply isn't reliable, people store it. But if there's just one little gap in a tank like this, the mosquitoes can get in and you've got yet another problem. Imagine multiplying that thousands of times.
Pregnant women are being advised to reconsider their travel plans to countries where outbreaks have been reported. But for these women expecting babies in Brazil, it is already too late.
I got Zika in the first weeks of my pregnancy, but back then nobody worried about it. When the link with microcephaly was made, me, my husband, my family, we all panicked. We started looking for any information we could find. Now I'm more relaxed because I'm 36 weeks pregnant, but I only wear trousers and long sleeves, and I hardly leave home except for my yoga and medical exams. In theory, if I've had it, I can't catch it again, but all the information about this case is very vague, so I'm not taking any chances.
To me, it's not a constant concern, but the other day I went out and suddenly a bunch of mosquitoes attacked my leg. I was so tense, so of course it's something that gets to you. My family and friends are really worried.
I try not to keep thinking about the Zika story and to enjoy my pregnancy, a magical period in a woman's life. I'm taking precautions like using mosquito repellent and covering myself up when I go out, but without getting too anxious. We really believe in giving our babies good energy, so I try to keep the bad thoughts away and to think only of good things for him.
Well, we can speak now to Dr. Richard Dawood, a specialist in tropical medicine. Marie-Claire Zari, who's being tested for the virus after she returned from her honeymoon in Brazil and 18 months pregnant. 18 weeks pregnant, not 18 months. That would be ridiculously long. Victoria Bacon here from the Association of British Travel Agents, and also Dr. Paul Cosford from Public Health England.
Good morning.
Good morning. Thank you all for joining us. Dr. Richard Dawood, first of all, it has gone from something most of us simply had not heard of to the World Health Organization now saying it's been detected in 23 countries and it's spreading explosively. How has that happened so quickly?
Well, there are many, many viruses that are capable of being transmitted by mosquitoes. And when this one first came to attention early in 2015, May 2015, it was thought that this was another very similar virus to in the kind of illness that it caused, fever, joint pains. There are other viruses like this, notably one called chikungunya, which had spread quite extensively within the Americas. The illness itself was quite mild and didn't really appear to cause much concern. Everyone expected it would spread, but it was only much later in the year when the rise in the number of cases of microcephaly, anencephaly, these very serious abnormalities popped up, that really this became obviously a much more serious situation.
And is it absolutely certain it is primarily a problem for pregnant women?
Well, it's yes. This is an evolving situation, so our understanding is progressing almost by the day. The problem is that it's quite hard to test retrospectively for it, so one has to piece together a jigsaw in order to know exactly what is going on. You can find virus when somebody is infected, and there have certainly been cases where pregnancies have been, where amniotic fluid has been drawn, where the virus has been detected. But it's a public health puzzle to put it all together and to know absolutely that there is cause and effect. But in the meantime, I think we have to go with maximum caution. And yes, I think this is a very alarming situation. I think the WHO has justly been criticised for taking too long to deal with previous public health emergencies. And I think we need to now give it maximum effort and attention.
Marie-Claire, you're pregnant, you were in Brazil on honeymoon. Tell us when you became aware of Zika and how worried you were and what happened.
Actually, so I was in the northeast part of Brazil, which was most affected. I had seen on TV an advertisement about mosquitoes. It was in Portuguese, so I wasn't too sure what it was about, but it didn't click at that time, watching the advert, how serious the message was. I received a phone call from my dad, who'd been on Google and who'd read the World Health Organization travel alert. He said to me, "Have you heard about this Zika virus? I'm not sure what you're doing there right now, but I would recommend you get out as soon as you can." So my husband and I jumped on Google and started reading reports about the Zika virus. I then talked to a few of the receptionists at the hotel that we were staying in and asked them what they thought about it, and they confirmed that it was very dangerous for pregnant women to be in Brazil at that point in time, that I should be wearing insect repellent. The trouble with insect repellent...
At that stage, had you already been bitten?
I'd already been bitten at that stage. Right. I had about 7 bites on my leg and my foot.
So how worried were you then?
I panicked when I read the reports about what it could do to babies, and I knew that repellent wouldn't protect me because I'm one of those people that gets bitten.
And you'd already been bitten.
And I'd already been bitten.
So you left within what, 24 hours?
Within 24 hours, caught the plane home the next day and came back to the UK.
And now you've been tested, and you've been tested twice, haven't you? Just explain what's going on with the testing.
Just to be 100% sure, I thought I'd give a blood sample to my midwife, and they sent it to be tested. And I also went to the Tropical Disease Centre in London, just following some advice I'd received. Because the test isn't routine like it would be for malaria, they had to send it off to a special laboratory, and that was why I wanted to provide 2 blood samples. Okay. But although I've had 1 test result back and it has been negative, what's worrying is that the tropical disease consultant told me 2 things about the blood test. The first is that there can be false positives because, as you've pointed out, it closely resembles some of the other dengue fever and other types of diseases. The second thing is that a negative result isn't certain. It could be that my bloods were taken too late because there's something about the time frame in which the blood is taken. For some people, the virus could last 3 or 4 days. For others, it could last 2 weeks.
So you're saying then all the way through to the end of the pregnancy, you're going to be worried, are you?
Yeah, basically.
Right. Yeah. Paul, how prepared are we here for this?
So the first thing to say is, of course, this is a tragic situation for all the parents and the babies affected in Brazil by the microcephaly. It's really important to get a couple of messages across. One is that this is a disease that's passed on by biting of mosquitoes, and the type of mosquito that transmits this disease, that carries this disease, is not one that survives in the UK. So we would not expect to have outbreaks of Zika virus in the UK. The mosquito that carries it doesn't survive here. Now, of course, it's a concern for people who are travelling to areas where Zika virus is being transmitted. And although the link isn't definitively proven yet. We're giving very precautionary advice, but that builds on...
So just spell out the advice.
So the advice for every traveller to anywhere where there are mosquitoes is to take standard precautions to avoid being bitten by mosquitoes. These are mosquitoes...
anywhere, even countries that haven't been identified as being Zika?
Any country that has mosquitoes and diseases borne by mosquitoes, whether it's malaria or Zika or chikungunya or dengue, or there are a number of diseases that mosquitoes carry. We don't see outbreaks of them in the UK. If you travel to a mosquito area, you need to wear long trousers, wear long sleeves, wear a hat, use approved insect repellent to avoid being bitten, and also sleep under a net. Now, the mosquitoes that carry Zika bite by day, so that's why it's very important to wear the long sleeves, the long trousers.
If you're going on a hot holiday, that's the last thing you want to do, isn't
It's
it?
a problem, but that's the advice. We can only give the best advice that we can. On a highly precautionary basis, we are saying because of the possibility, strong possibility of a link with the microcephaly, we are suggesting to pregnant women or women who are thinking of becoming pregnant to talk to their midwives, to talk to their doctors, and to think about whether they might wish to delay their travel.
I mean, should they not just not go? Should they just not go?
At the end of the day, it's a personal decision. And it's based on how important it is for the individual to travel. So, of course, the woman themselves is best placed to make that decision. We can give the advice that we give about consider delaying travel to an area that's affected by Zika at this stage.
So on the travel issue, Victoria, if somebody cancels a holiday or is away and wants to come back because of the Zika virus, will they be out of pocket? How is this being handled?
Well, it's
by
essentially,
companies?
I mean, obviously it's clear to sort of distinguish, I think, between women who are pregnant and the rest of the travelling public, if you like. Clearly, as we said, the symptoms are mild, like other viruses, but if you're an adult and travelling, if you are pregnant, the key thing to do is to talk to your doctor, talk to your GP, and also get a medical certificate. That's very, very important. Your travel insurance may not be validated basically without that medical certificate.
But if you get a medical certificate,
if you get a medical certificate, talk to your travel provider. I can't speak for every airline, but I can speak certainly. ABTA members, most of of our larger members now have come out with their policies on this, and they have said that you do have an option to either change your destination, change your travel plans, or get a refund for that.
What if you're not going through an agent? What if you have booked something independently or direct with an airline?
It will be dealt with on a case-by-case basis. So you should talk to your travel provider basically. But it is very, very important, as I say, that you have that conversation with your GP and get the medical certificate. If you're pregnant.
And if you're not pregnant, you've got no hope of a refund? Is that right?
Well, no, because I think as we've said, obviously the symptoms are like any other virus. There are many tropical. There are more experts on this panel than me in terms of the impacts of tropical illnesses, but there are lots of other viruses, and I think actually that's one of the things that perhaps has been misconstrued a little bit in terms of if you're an adult and you get a virus like this, if you're not pregnant, then actually the symptoms are very mild. So clearly you're in a different position to if you're pregnant.
Richard, you were saying at the beginning we're kind of feeling our way through this a bit in terms of actually finding out more about the virus because it is so new. I mean, is it clear if a pregnant woman did get infected by the Zika virus, is it an absolute certainty that the fetus would be damaged?
No, we don't know. We're still crunching the numbers, and there's a lot more detective work to be done. For example, we don't know whether or not you need Zika plus something else. Although Zika has been known previously for some time, this association is quite new, and most of the cases have occurred in Brazil, most of the cases of the abnormalities. So there's a lot more that needs to be clarified, and I think, as everyone is saying, this is out of, to quote the Americans on this, it's out of an abundance of caution. This is something we're trying to be cautious about simply because the problems are so potentially devastating. So that's
lots of people are getting in touch and asking questions, so I want to do some quick fire questions with you. I mean, and obviously answer them as best you can based on what you were just saying there about the knowledge of it. JGM on Twitter, male travelling to Brazil, what are my risks? If I contract the disease, what are implications for a male?
Obviously take all of those precautions, covering up, using repellents, using nets, reduce the number of bites. If you take careful mosquito precautions alone, you can reduce the risk of a mosquito-borne disease by 90%.
But he's asking, what are the implications
what
for
are the
a male?
implications? Well, if you get sick, there's potentially an illness. 80% of people who get this virus have no symptoms.
Okay.
Of the 20% who can get sick, it ranges from something very minor to something a bit more troubling and annoying. There is a theoretical concern that has been raised of whether or not the virus can persist in body fluid. This potentially has the risk of being a bloodborne virus as well. So there has been some concerns.
How long will it take for us to know whether that's the case?
Well, there has been concern, as with Ebola, where virus was found to persist to be protected in fluid-filled spaces such as the eye and in semen. So that is a potential concern.
And that would change the picture dramatically
Well,
if it were that case.
it changes a bit.
Yes, of course. Yeah.
There is one reported case of sexual transmission which is being investigated to see if it is genuine. It's a very, very low risk. What we are advising for males who travel to Zika-affected areas, from their own point of view, take all the mosquito precautions that we've talked about. If they get infected, it's a mild illness. But the very theoretical risk would be if their partner is either pregnant or considering becoming pregnant. So if you've been to a Zika-infected area, we're simply advising use condoms for 28 days after you return, by which time our best advice at this stage is you would be unlikely to be even have that very, very minimal risk of transmitting to your partner. So just to be aware, just to take that added extra precaution.
Okay, I mean, there's another question actually which is sort of following on from that then. Tiong on Twitter, can the virus be killed by antibiotics? And if not, can one be a carrier for the rest of his or her life?
There is no specific treatment to kill the virus, but the infection lasts for about up to a week, and it occurs about up to a week after being bited by a mosquito.
Okay.
Yeah,
we're out of time. We've been through obviously a lot that I think will be helpful for people watching. Thank you very much indeed. Good luck with the pregnancy and everything on that. And thank you for joining us today. Still to come.